The following video is for educational purposes only. Please use this information with discretion. Our intent is to help you become a more informed healthcare consumer. Ortho University presents Biceps Pathology of the Shoulder by Dr. David Eisenhauer. And now it's time to OrthoU.
Hello, I'm Dr. David Eisenhauer. I'm a board-certified and dual fellowship-trained orthopedic surgeon specializing in surgery of the shoulder, elbow, and hand. Today we're going to discuss biceps pathology in the shoulder, what it is, how to diagnose it, and how to treat it. We're going to give you some simple home diagnostic tools as well as some simple home treatment recommendations which may help save you that initial doctor's office visit. First of all, what is biceps pathology in the shoulder? Biceps pathology can come across a spectrum from a inflamed biceps with biceps tendinitis all the way up to a biceps tendon tear and really anything in between. Some patients also will present with instability or a dislocating biceps. The biceps, we all know, is a muscle that lives here in the front of the arm. As that muscle thins out, it turns into a tendon in the proximal third of the arm, and it comes up and it wraps around and it inserts into the top of the socket of the shoulder on what's called the glenoid. And it runs through the rotator cuff. And typically, as it's coming into the shoulder, running under a band of tissue and through the rotator cuff, that's where the biceps can become inflamed. That's where tendinitis can occur. Occasionally, this band of tissue can rupture or become loose, and the biceps can hop out of its groove. It actually lives within a bony groove in the upper arm bone or the humerus before it inserts onto the socket. And so if patients are feeling popping or clicking in the front of the shoulder, oftentimes that's biceps pathology or a dislocating biceps tendon. If they have a vague pain in the front of the shoulder, that may be associated with a biceps tendinitis. A biceps tendon rupture is not uncommon at all, and I see this relatively common in my clinic where patients are lifting something and they feel or hear a pop in the shoulder. About 30% to 40% of those patients will develop what's called a Popeye deformity. So where that tendon retracts down once it's been torn, this biceps muscle can ball up. And when patients make a muscle in the mirror, they'll see that this biceps looked deformed. It looks sometimes a little bit bigger or a little bit more prominent than the biceps on the other side, which is more thin and spread out, where this one is bunched up and contracted. So that's certainly a simple self-diagnostic tool that patients can use if they felt or heard a pop in the shoulder. Otherwise, if patients are experiencing anterior shoulder pain, just follow the biceps up and right in the front of the shoulder. Sometimes you can feel the biceps groove actually over the head of the humerus or the upper arm bone. Just kind of rub that area back and forth. If you can feel pain there, that's an irritated biceps tendon. With deep enough palpation, however, most patients will have some pain over their biceps tendon even if it's not pathologic. So palpate that area, see if that elicits pain. Something else that you can do is with resistance, turn your palm up. Sometimes that will elicit pain up in the shoulder as well. The main job of the biceps actually is to supinate the forearm. Most patients think that it's to flex the elbow. We think of biceps curls. Actually, the main job is to supinate the palm or to turn the forearm up. So resist that, and if that causes pain in the shoulder, that may be a biceps tendon problem. You can also resist your arm going straight up. That can cause some irritation and some pain in the biceps tendon as well. All of these are maneuvers or exams that I would perform in an office setting as well. Additionally, I would get x-rays. I would check for any bony pathologies such as arthritis or bone spurs or any loose pieces of bone floating around in the shoulder. Oftentimes I will end up getting an MRI. The x-ray only shows me pathology of the bones and the joint. I can't see the biceps tendon on an x-ray, so I'll order an MRI and then I'll see the patient back to review the MRI. And if the biceps is inflamed or partially torn, typically we talk about conservative treatment of that. For home treatment, This would consist of activity modification. So essentially, if it hurts, don't do it. And I know patients hate to hear that, but any repetitive motions, any overhead throwing activities, anything that's going to keep that biceps irritated and inflamed, try to lay off of for 3 or 4 weeks. Non-steroidal anti-inflammatories such as Aleve and Motrin can be a very potent treatment for this if you have your primary care physician's permission to take these medications. Please do so. Physical therapy can be very helpful for this, whether you seek online physical therapy. There's a portal through MoonlightOrtho.com to chat with a live physical therapist and get some instruction, or dedicated physical therapy at a therapist's office. Oftentimes a steroid injection can be very helpful. So when patients come see me in the office, if this looks like this is just an inflammation or sometimes even a partial tear of the biceps, we'll put a steroid injection into that area, which can be very helpful for the patient's pain. And then failing conservative treatment of this, we talk about a arthroscopic procedure to go in and look at the patient's biceps tendon.
We pause now with 2 minutes left in the video and ask that you open a separate browser screen and go to MoonlightOrtho.com, where you can quickly register for a free patient account and get immediate access to the final portion of this video, including home treatments and remedies, along with any additional treatments that may be prescribed or recommended in office or via telemedicine, including when it may be time to consider surgery. This also gives you full access to the entire OrthoU video library, highlighting all of the most common orthopedic conditions. Once registered on Moonlight Ortho, patients will have an all-inclusive orthopedic telehealth hub at their fingertips and can pay to be seen by a board-certified and fellowship-trained orthopedic surgeon. Moonlight Ortho is the first and only orthopedic-specific telemedicine practice where patients can be seen online by a board-certified orthopedic surgeon. Via telemedicine, patients can receive X-ray, MRI, lab, and physical therapy orders, along with prescription medications, all within 24 to 36 hours from your time of visit. Thank you for watching, and if you enjoyed this video and appreciate the free advice that our surgeons have offered you, please rate and subscribe.